So my vision for personalized healthcare is that we take it above the level of just the person and think about it in terms of populations as well. I think there's a real opportunity for the work that is underpinning PHC to drive improvements in health and social care broadly that can help to reduce some of the inequities that we know exist and are major drivers of adverse outcomes in our system. And I think that's a real opportunity. So where I think we can really move here, and one of the great opportunities that's presented is that by virtue of the masses of data that are becoming available in multiple domains, whether you think about genetic data, or you think about health system data, or you think about environmental data, social data, behavioral data, all of these areas where we're getting more and more data available every day, including in some cases at scale. I think there are opportunities to bring that data together to have a much more holistic view of what is truly, what are the main drivers of good health, good well-being, bad well-being, and so on. And I think that the PHC agenda can really support that. Well, there's clearly, barriers at multiple levels. There are technical barriers, technological barriers, and so on, but I think those are all ones that we can actually overcome relatively easily. There are also, though, cultural barriers in the sense that when we think about all of the various domains that I've mentioned, you're talking about different kinds of people who work in those areas and traditionally have not necessarily worked together. So we really need to think about bringing a whole range of expertise and a whole range of communities together that haven't traditionally worked together all that closely. Again, it's a barrier, it's also an amazing opportunity.